We want to get straight to your top story this morning, which is the growing health concern across the DMV after that measles exposure. It happened at Dulles Airport, and another child death is tied to the flu.
Yeah, Joy Wang will have the latest on that flu death in just a moment. But first, we want to turn to reporter John Gonzalez, who is live at Dulles Airport. So, John, you have been speaking to doctors here locally who say, a measles outbreak is just extremely rare.
That's right, Adam. They tell me that these many cases at once in the country is really almost unprecedented. And out of an abundance of caution, health officials are working with Maryland health officials here in Virginia to try to determine if there's anyone else that came in contact with the person who was here, a patient that now has measles, and of course, especially those who were part of the international arrivals section here at Dulles Airport. They want to make sure that they've talked to everyone that may have been exposed. Now, right off the bat, if you have been vaccinated for measles, you have very little to worry about. If you were born before 1957, you were more than likely already infected, so you are in the clear. And for those who just aren't sure, if you attended public schools or did military service, more than likely you are. Now, for those who aren't vaccinated, this could be harmful and dangerous. Early symptoms of measles are a fever, runny nose, cough, and conjunctivitis, red eyes, kind of like when you have pink eye. Interestingly enough, one of the last symptoms days later is the red rash that spreads all over your body, heavier on the head and trunk. A person with measles is contagious 4 days before a rash and must isolate at least 4 days after that rash appears.
It used to be very widespread in the U.S. For most children, it was a rite of passage. You would grow up, everybody had measles, and most people did fine, but not everybody. People ended up in the hospital. Some had pneumonia, some had brain infection with permanent consequences, and 400 to 500 died each year. So, if that's preventable by a shot, I'd go for the shot.
And really part of the big reason why they're trying to find anyone that may have been here at Dulles Airport is because symptoms typically develop a week or two after exposure. Now, even though there is a certain percentage of people that are not vaccinated, most people are, though. So this should not be, doctors say, a widespread event, nothing like what we saw 5 years ago, of course, with COVID. Now, if you are looking to get vaccinated and you can't get to your doctor's office, I've searched, I've looked, and you can go to a CVS or a Walgreens. They offer these shots free of charge. Reporting live at Dulles International Airport, John Gonzalez, 7 News.